Wellness Community e-talk show with our new series, Youth and Mental Health. On last week's episode, The COVID-19 Impact on Mental Health, Anu and Dr. Sujoy talked about how deeply people's mental health and wellness were affected by the recent pandemic and restrictions. For this week's episode, Resources Within the Community, we will be highlighting the importance of communities and how they can be a support system for people going through mental health challenges. Before we head in, let's visit Jatin in our news corner.
Hello everyone, this is Jatin and welcome to the news this week. A new resource guide created to promote the mental health and well-being for Black Canadians launched in Manitoba this week. This toolkit will have information that will help everyone to be able to provide culturally relevant supports to Black Canadians in times of their mental health needs, said Titi Tihani, President of the African Communities of Manitoba. She said that the aim has been to make it easier for people seeking help or answers about mental health access resources. In addition to that, it was also created to provide information on what factors impact mental health for Black Canadians, such as housing, education, racism, discrimination, healthcare, and poverty. In other news, on December 11, 2020, the Canadian House of Commons voted unanimously in favor of MP Todd Doherty's motion calling for the federal government to establish a national 988 number for mental health crisis calls and suicide prevention. Not only would a national 988 line improve access to resources, but it would also provide an alternative to 911 and reduce unnecessary contact with police for those in a mental health emergency. A 988 national line could also help reduce the stigma associated with mental health illness. Moving on, every person's needs are different. There's no one-size-fits-all when it comes to therapy. That's why there are hundreds of mental health services out there, including therapists, organizations, non-profits, and support groups that understand the specific challenges you may face and the kind of support that could help the most. Many therapy services are tailored to meet the needs of specific communities, people with certain mental health conditions, and provide support for all kinds of personal challenges. If you're looking for a therapist for your specific needs, you can find the link to this article in our social media feeds. Now it's time to head into the unscripted talk segment with Anu and a special guest of the week. Thank you.
Thank you, Jatin, and welcome to the 9th episode of the Youth and Mental Health series by We Serve Canada. For the past many weeks, we have delved into numerous topics related to mental health and wellness. The biggest challenge that the individuals face are that they are unable to reach out for help. Now, why is it so? It is not as simple as it seems. Many people do not seek guidance because of a variety of factors, which may include in denial of their struggles, maybe believing that the treatment will not resolve their issues, not wanting to become a burden on their family and friends, the fear of judgment and stigma that goes with mental illnesses, misinformation, and much more. Another aspect that correlates to people being hesitant to seek guidance is the lack of the mental health support that is available and accessible for everyone. The Center of Addiction and Mental Health also shared that an estimated 75% of the children with mental illnesses do not have access to specialized treatment services, And those that do, the wait times for counseling and therapy can be really long. However, in the past few years, the awareness for the mental health and wellness has been on the rise. There are now many more organizations and initiatives throughout the globe to support everyone's mental health and wellness. So let's take a look at these different resources within our community with our very special guest, Dr. Sujoy Ray, who is a psychiatrist, a clinician, and a researcher. Thank you. Hello, everyone, and welcome to the We Serve Canada e-talk. We have a very special guest, Dr. Sujoy Ray, with us, and we're going to delve into our topic of this week. It is alarming to see that the statistics of how underfunded mental health is and how many people feel that their needs have not been met. So, Dr. Sujo, I think I'll jump right into the first question that could you explain that why there is a lack of support services available for those who are in need of mental health and they might have issues and however there is a lack of support of these services. If you can just elaborate a little bit on that.
Yeah, hi, and thanks for having me here. So the way I understand it is that mental health is actually uh, often it's an understudied or an underfunded area of health because if you look at earlier times, we did not have an understanding of it at all, and now it has started to come up gradually. So something which is not understood, whether it is mental disorders, the reason why they happen, how to prevent them, why do people behave why do people present with those features when they have mental health issues. Those things are not very well understood yet, although things are changing, which is why probably which is the reason probably why the resources are not allocated to mental health that much. Uh, it is because even if it's the general public or it's even the medical fraternity, everyone has difficulties trying to come to terms with this. It is difficult to explain to people. Even now, we don't know the origin of a lot of mental diseases, mental health illnesses. Research is still ongoing. So, if something which is not understood clearly, always often creates a problem in being communicated to the public and and so it does not find the importance which is required, which it deserves. And this is probably the reason why that much of allocation is not yet done to mental health aspects.
So one thing that I feel, Dr. Sujoy, it is also possible that, I mean, we started off our discussion with breaking the stigma on
Mhm.
mental health. So maybe it is one of the things is that because people don't come out as much because that stigma of having a mental health issue is still
Mhm.
so prevalent that not that many people in the demographics are coming forward. So obviously, the government works with the fact that like the percentage of what sort of ailments are in the demographics, and based on that, the fundings and all that are given. So I'm thinking that maybe that obviously is one of the reasons that not that many people come forward with their mental health issues. So it is not highlighted in the government, and then obviously because of that, there is also, to a certain extent, there is a lack of government support for that sort of funding and things like that. I'll jump on to the second question. It has been discussed that how professionals, maybe therapy, friends, and family can provide a great resource to guide a person to the path of recovery. But how could you explain exactly that? How can actually a community help an organization in terms of their mental health?
So, I mean, community is actually the main support for any person suffering from mental illness. The thing is that even if he gets treated in the hospital by doctors, in a hospital environment or in a rehabilitation environment, and ultimately he or she has to go back to the community and live his life over there. So in that case, community can help a person who's mentally ill by sort of uh, continuing to give him the support which he needs. It can start at the very beginning. It could support a person who wants to come out with his mental illness but feels shy or stigmatized about it. And it can help him to find the appropriate mental health professional or care. It can help to support the family of the person. It's difficult to care about a person with mental illness. Families
Right.
get exhausted, caregivers get exhausted. They have to deal with, they feel embarrassed about it, they feel separated about it. So the community can make them feel, welcome, and make them feel that this is not something that they are doing which is wrong, or there's nothing to feel guilty about it. So that way the community can continue to support the treatment and well-being of the person. And finally, at the end of it, that once the person is well and back into the community, they can help him get into something important. I mean, get into a job, get into some work in a gradual phased way, so that he does not feel that he's just wasting his time, or the family does not feel that he or she is a burden to them. And so the community can help in multiple ways. And apart from that, they can create awareness. If it is difficult for mental health professionals to tell the general public directly about what mental health illness is, community leaders or people who are influential in the community can carry the message from the mental health professional to the general public. And coming from community leaders who are somebody the public already trusts and knows, it will have a
Right.
better message. It will be a strong The message will be stronger, and then the public will be able to understand better about mental illnesses.
So you actually sort of touched upon my third question, which I was just going to highlight is what is the role of the community leaders or the spiritual leaders in improving the mental health and well-being
Mhm,
of an
mhm,
individual? And you touched upon that, but I also wanted to highlight to a certain extent that We Serve Canada is proud that in some way that we are also that part of the community solution that we are trying to offer. Obviously, right now we have online things, so there is not so much of the physical presence of those people. But
mm,
once things open up and these events or these sessions that we are doing, they start happening on a physical uh, basis, then people can actually drop in and they can be in touch and communicate with us and be part of
mhm.
the community. So, anyways, just going back to that, you touched upon it briefly that about the community leaders. Is there anything you want to add more on that aspect?
Yeah, so I think spirituality, religion, these are very important things because these are close to people's hearts. They give a lot of respect to godly figures or spiritual leaders, and any information coming from them is very it will be held in high regard. Many people, even in mental illness, many people often turn to their spiritual leaders. Sometimes they do not trust medical or doctors or medical illness, medical treatments. So they turn to spiritual leaders, and if the spiritual leaders themselves give the message that this is, a medically treated illness, and it should not be seen as some sort of a punishment or some sort of a punishment from God or things like that. So that if the spiritual leaders themselves give that a message and work together
Right.
with the doctors, so there will never be a conflict. People will not think whether I should go to a doctor or a spiritual leader, because they'll have the knowledge that it's the same thing. It's a disease and it needs to be treated, and both doctor and spiritual leaders can play a role in treating them.
Okay. All right. All right. So, for individuals who are actually experiencing mental health challenges, many are still hesitant to reach out to their family and friends. So, like we said, that community organization is a good starting point for these people.
Mhm,
And I know that you are in UK and England, so I will not talk about the resources and the services that are available specifically in Ontario or in Canada to promote an individual's mental health and well-being, but maybe you can focus on some of the broad resources that would be available for all of us, and especially in this day and time, like maybe the internet related or the online resources that you think would be available or would be a good resource for somebody to get help and support. It would be good if you can highlight some of those.
So I think as far as resources are concerned, the best thing, of course, to do is to speak to the doctor, speak to your local practitioner or mental health practitioner, or even, for example, general practitioners. They would give you the right information. Usually, people they have patient information leaflets which they give out to patients and carers, caregivers, and families, so that they can understand in simple term what the illness is. uh, it is good if doctors or medical fraternity come forward and conduct workshops or some programs for the general public. Not, I mean, apart from academic conferences are always there, but for the general public, if there are programs and things like that which explain about mental health illnesses in a simple way. If even say, things like entertainment and media, simple things like some plays, movies, stories about mental health illnesses, uh, stories of those people who've experienced mental health illness and what how they went about it. There are already movies and books written about that. But then, if you talk about online resources, there are different online resources. Every country has a psychiatric association. There's an American Psychiatric Association. There's a Royal College of Canada. There's a Royal College of UK, Indian Psychiatric Society. So every country, even like entities like say South Asia or East Asia, they have psychiatric societies or psychiatric associations. They have websites, and those websites will have sections like they will obviously have the medical and the scientific aspects, but they'll have sections like what to do if you suffer from mental illness, what to do if you are a carer of a mentally ill person, and those, again, those online e-pamphlets will be available in simple language to understand. So I think this is the sort of resources you should go to, because otherwise if people just Google things, then all the things that come out may not be uh, factual or may not be accurate. But if you know that the website or the online resource that you are seeing is a certified, you really be able to identify. So if it's certified by the medical association or psychiatric association of that country or region, then that is something reliable which the people can understand. And I'm sure that they understand that there are a lot of immigrant populations and different people who may not say speak English or the language of their places. So they have pamphlet and information in different languages.
Right, 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 right. No, I'm glad that you pointed that out, to go to a registered site, or
Registered.
like a validated, a legitimate sites, because nowadays with so much of social media being out there, with WhatsApp and all those other things, like
Mm,
I mean sometimes it might actually be worse for the people, because
mm,
they are just going not to the right sources to get the correct information. So definitely going to the right sources, to the legitimate sources, would be the best thing to do in this scenario. So thank you, Dr. Sujoy. This wraps up our episode for this week, and we'll see you again next week. Thank you so much for being part of our show.
Thank you for
Thank you.
having me here. Thank you.
And that wraps up this week's episode. Thank you to Dr. Sujoy for emphasizing the important role communities play in a person's life. We encourage you all at home to look up the local communities within your area to help cope with the life changes the COVID-19 pandemic has brought upon all of us. Stay tuned, everyone, for next week's episode, Self-Care and Loving Oneself. It will be the last video in our mini-series, Youth and Mental Health. The 10 weeks have flown by so fast, and VServe Canada is overwhelmed by the amount of support we received for a new e-talk show. This isn't goodbye forever. If you have a new idea or topic that you want to see us cover in our next series, please leave a comment or DM us. As always, give this video a like and share with your friends. Be sure to hit the notification bell button and the subscribe button to be updated when our last episode is released. Follow us on our social media at VServe Canada to stay in the loop on our future events. See y'all next week. Bye!